Hi guys, it's Dave. Today coming at you with some information regarding Turner syndrome or gonadal dysgenesis. It occurs in females. It's a chromosome disorder where they're either born with one X chromosome or part of an X chromosome, or in a third case, which is even more rare, a little of an X chromosome with more Y material. So it's mainly Y that's overtaken the X chromosome on there. So that's where it's coming from, is a chromosomal disorder. The symptoms of it are shortness or being a short stature. There is also delayed puberty seen with this, a wide neck that can even look webbed. The ears can be down lower than normally. Your jaw can be a little different as well. There can be some heart defects or abnormalities there. Short toes and fingers, and the nails actually look like little cups on them as well. Slow growth is something else where normally a kid will hit a growth spurt, they'll be eating a lot, they'll shoot up a couple inches in a month or 2 months. That does not occur with this. As far as a diagnosis, it can be diagnosed during pregnancy. They can do a test that you can actually see if this is occurring or not. Generally, you're going to see it diagnosed in infant or in early childhood. However, if it is a mild case where maybe part of the X chromosome is there, or you have the interference with a partial X chromosome with some of the Y material included as well, you may not see it till teenage years or even early adulthood, when you're trying to get pregnant, you're having infertility issues, or you're having some abnormalities going on with your heart, okay? With that, the risk factors. As far as risk factors, it's random. It basically is hit or miss. It's not a matter of genetics. It even isn't a matter of doing something while you were pregnant, like if you were using drugs or alcohol, or if you got injured or something like that. Really, there's no association with that either. It's just random occurrence goes on with that. As far as problems that occur with this syndrome, again, there's developmental issues physically. There's developmental issues mentally as well. Your heart can be structurally deformed, so you could end up having a heart attack and not know why, and it could be a valve issue. The aorta is predominantly involved with some of the issues that are occurring there. It can cause hypertension or high blood pressure. You can see kidney issues as well. Autoimmune diseases are prevalent, so you can see things like Crohn's disease, Hashimoto's, diabetes. Those can all be seen with this. Hearing loss is prevalent with this, as well as vision issues. And you can actually see in younger age kind of a squint occurring with patients that have this, and it is related to the vision issues. Lymphedema, which we did another YouTube video on that disease, that can be seen with this as well. Osteoporosis and scoliosis, where the bones are not forming like they should or completely. That is another issue seen with this. Infertility, problems getting pregnant is something else you see with this because of the chromosome disorder involved. And then, of course, mental health issues. There's going to be, you're more prone to anxiety and depression, of course, as you would imagine, having this kind of disease, as well as ADHD. With the ADHD, there is a lot of impulsivity that's involved that you have to watch out for in children especially, and teenagers, because they can do things that are harmful to themselves without even thinking about it. And the bad thing is, because of the genetics, meds do not treat the ADD or ADHD effectively. So they're not going to be a good candidate for things like Ritalin, Adderall, Focalin, that kind of thing. As far as treatment for this disorder, growth hormone is used quite typically because they want to get you to grow to a full size. Estrogen therapy absolutely will be necessary. Again, you're missing one of those chromosomes. So especially if you want to induce puberty at a normal age, they will use estrogen therapy with some progesterone as well. And if you're trying to get pregnant, they will be doing that as well to help get pregnant. As far as life expectancy, there is a shorter life expectancy than normal, but it's not huge. It's about 13 years. So honestly, anybody could walk out and get hit by a bus, okay? So realize this is not a death sentence. However, you do want to keep all your appointments with your eye doctor, with vision changes, with your regular doctor, with things that can occur with autoimmune disease, with specialists regarding diabetes, as well as obesity, because you will be more prone to that too. Hearing doctor, your audiologist, you want to go see them as well, because again, you can do a lot of things to help treat some of these symptoms along the way to live an independent, full life, as long as you're keeping your appointments, staying up on lab work, things like that. If you happen to have this disease, or you have a child or grandchild or relative that has this disease, please contact the National Congenital Anomaly and Rare Disease Registration Service. Again, the National Congenital Anomaly and Rare Disease Registration Service, because they're trying to keep track of rare diseases to help people with them, to help form treatment plans for them, to help see if there would be any medications that you may be able to be put on as far as a study or anything like that.